Hi, this is Nicole Birkholzer of Mindful Connections, and this is the Red Sofa series. My mission is to mindfully connect horses and humans, and with this show, I'll bring you expert perspectives on everything equine and mindful ponderings from our own backyard. May you be informed, inspired, and mindfully connected. Hi, this is Nicole Birkholzer of Mindful Connections. Today I'm here with Dr. John Perdrizet from the Sanctuary Animal Clinic in Holyoke, and we're going to do some acupuncture on Shana because Shana's feet are still not doing great. She had laminitis in the winter, and we provided some acupuncture relief during that time, and she seemed to benefit from it quite a bit. And now her laminitic tissue is growing out, and she's really sore, and we're hoping that this will provide relief again. So, I don't know, Doc, if you want to check her and see what you think about where she's at right now.
How's she been for the last couple days walking around? Is she comfortable walking at all, or no?
Not so much. She was on the bute and banamine that you had given her. I'm going to start her tomorrow on herbs. They're in the mail for it, but she seems very sore. We did her feet, and you can see here the red kind of growing down. Here's the line, the laminitis line, and she doesn't want anybody touching her feet. And I don't know if I have a hard time feeling the pulse sometimes, if she has a high pulse. And
okay, well, when you feel her pulses now, they're definitely elevated. They're almost bounding. So there's a lot of flow in her arteries, or digital arteries. She doesn't have a lot of heat in her hooves. You can feel a little bit, but that's where digital arteries are more important than just feeling for heat. Because even if it were a hot, sunny day, it's hard to tell if they're hot, or if your hands are cold on a cold day and you touch the hooves, they can feel warm. So warmth on the hoof wall can be a hard
tricky
thing to discern, whereas the pulse can tell you so much more.
so, but the pulse indicates that she is.
But there's increased arterial flow to the feet, so there's increased inflammation.
And that's not a good thing, right? Yeah.
It's not necessarily always that those pulses are increased with laminitis. They can be increased with other diseases of the foot, so it's not what they call pathognomonic. That's the term for something that if there's a sign, it means you definitely have the disease. So it's not a telltale 100% sign.
Come here, I'll fix you up. Yeah, come here.
A visitor.
Yeah, she has, I think, a tick under her belly or something. She's like. So the question, though, is because we looked at the hoof walls recently and the soles, and I think we fixed it a little bit, but and we checked if she has Lyme, and she doesn't, right? The blood work said it's not. So what else could be going on if it's not laminitis?
Well, it's definitely, I believe there's laminitis. There's
Okay.
no question that there is laminitis.
Okay.
I'm just saying that just because you feel increased digital pulses does not necessarily mean it is laminitis.
Okay.
But
In her
because
case.
there is warmth in her feet, and the way she is walking on eggshells, she's tender,
Yeah.
that shows that she has most likely laminitis. And one of the best ways to determine if there's foot pain with laminitis is to try to get a horse to turn. See how she doesn't
Want to move her
that.
feet? Yeah.
But when they turn, it puts rotational
Pulls.
pressure on her hoof capsules, and they feel that, especially with laminitis.
Yeah.
And the fact that she'll point her foot out like that says it hurts more. And in fact, when you feel her digital pulses, this left foot has a higher pulse rate than her right. So this one is bothering her more right now. To know how severe.
I know. And she doesn't even want, see, it's so funny, she doesn't even want us to touch it. She's like so protective of it.
So clinically, to tell how severe the laminitis is, it would be helpful to get radiographs.
I was just going to say, so should we do x-rays since we've been now doctoring around with this for a little while?
At some point, yes, we probably should get some radiographs to see how the degree of severity. But
Shh.
Right now, I'm just taking her mandibular pulse just to get a rate, because the heart rates, how many beats per minute, gives you a good idea of how painful they are. And since she hasn't been on any pain reliever for how long now?
Since this morning.
Since this morning.
I mean, she had it this
Yeah,
morning.
okay, so there's still some residual. You're giving her the butte this morning will still have an effect on her today,
But the thing is, she's been on it now a week. I don't want to keep her on it
Right.
for much longer because her stomach and everything else.
yeah, you don't want to keep them on anti-inflammatories for too long. If they're stressed, you don't need to get stomach ulcers or kidney problems. But right now, her pulse is about, it's in the mid-40s. It's not real high, but it's not normal. It's above normal. Normal would be 28 to 40, and it's about 45 to 48 right now.
Mm-hmm.
And now I'm just taking a look at her gums to make sure she's hydrated, and she is. They're glistening and they look well. And making sure her refill time is good so that her cardiovascular system is working the way it should. Her tongue, and this is different than Western medicine. Everything I've done so far is Western medicine, but if I look at her tongue, okay, if she had a real inflammatory process going on in Chinese medicine, she would have a very red tongue, but her tongue isn't red.
So that's a good thing then?
No,
No.
not necessarily. It's not good or bad. It's just categories of disease. So if her tongue were really red and she has laminitis, it would be an excess disease. There's excess and deficiency diseases in Chinese medicine.
Okay.
This in their case, falls into a category of there's an underlying, even though there's an excess going on right now, we got excess inflammation in the feet, there's an underlying deficiency because
It's
her tongue
more
is
pale?
pale.
Okay.
She doesn't have a red tongue. She has a pale tongue.
Can you see the tongue? Show your tongue. Show everybody your tongue. Come on.
So that says that we've got deficiency signs going on, not just excess. We have local excess, but generalized deficiency.
Well, obviously, because there is something out of balance with her, and it seems like there has always been something a little out of balance for her. See, now she's sore also all throughout her body, right?
Yeah, well, when they have to stand
Like that.
and protect themselves, then
Right.
it will start to affect her axial muscles, not just her
Right.
muscles.
Baby girl.
She's sore. You're sore.
That feels good, though, actually. Look at that. She's like, I kind of like that. So maybe I can massage it a little.
Okay, so you can tell that at this point that we've got inflammation in the feet. We obviously know that from the increased digital pulses, but she also has a deficiency underlying it all. So you can treat her at two different levels. We can treat the local stagnation, both in Western medicine and in Chinese medicine. This is a stagnation. The blood is rushing to the feet, but it's not.
Can't go anywhere.
That's coming out the way it should.
Yeah.
And so you get a decrease in the microvascular, the circulation in that hoof wall, and you start to get little tiny micro blood clots. You get an increase in the release of cytokines or cell enzymes that are going to destroy or inflame the local tissue. So from a Western standpoint and from that's what's going on Western, and from a Eastern standpoint, Chinese standpoint, what you've got is anytime there's pain locally, you've got abrupt stagnation of qi. So qi flow has stagnated in the feet.
Qi being the life energy, right?
Right. A pale tongue says she has a decreased qi generalized. But here she's got a decrease in qi flow, specifically in a local way. And anytime you decrease qi or block qi locally, it causes pain.
Okay.
And so that's what she's
Dealing,
manifesting.
yeah.
So we should probably put some acupuncture needles in her just for her local effects to help try and resolve some of the qi flow, get her qi flowing in her feet better. And from a generalized effect, more general effect, we can put acupuncture needles that will have effects with her overall chi rather than just in the flow in her limbs.
Mm-hmm.
All right, sweetheart? Mm-hmm. So let's start. I'll start with just a couple of acupuncture points that are called calming points. Anytime you start working on an animal, you want to start with points that calm them. You don't want, especially if you're going to be putting needles in spots that are painful, you want to start by putting in needles that will help bring their energy level down and get them more comfortable. So here we are with Shana again, and she's got laminitis, and from a Chinese perspective, she's got a decreased qi flow in her feet, or a stagnation of qi that causes pain. We also saw that she has a pale tongue, and she's got some back depression areas that are painful, and those are signs of more of a generalized decrease or deficiency disease. So first thing that we'll do before treating both the local stagnation and the overall deficiency is to put in a couple acupuncture points that are considered acceptance points. They're points that most animals don't mind an acupuncture needle going into, and once the needle's in there, it helps bring their energy level down so that they'll accept needles in more painful spots. So we'll start with Bai Wei, which is right on the midline. Bai Wei in Chinese means point of 1,000 crossings. It's one of the major spots in the body for both qi flow from the universe into the body, and also the crossing of many of the different qi channels in the body. So we're putting about a 2-inch long needle down into that spot. And most of the time, if you watch them closely over the next couple of minutes, she'll start to get a relaxed look in her face. Could I have some 1/2 inch right now? Just 2 1/2-inch ones. The 28s, yeah. Great, thank you.
I mean, I've been really trying to keep her off the grass. It's difficult on this property because wherever you go there is some grass, but we've been really, feeding hay more than anything.
Okay, sweetheart. Okay, let's go with this spot.
But the problem is if I just keep her in the sandy arena here where there's no grass, she doesn't move enough. Because we obviously also want her to move, right, if she chooses to.
Mm-hmm.
To keep the flow going or not? What is at this point there?
Well, it's damned if you do and damned if you don't. You need to keep movement because you do want there to be increased flow of blood in the tissues. When those limbs move, you not only increase venous blood flow, but you also increase lymphatic blood flow, or lymphatic flow up the limb. And if you don't do that, you get more stagnation. However, if there's a lot of inflammation in those feet and she moves them too much, then you start to get breakdown of the lamina, or the fine tissues that hold the bone to the hoof wall itself. So you want her to move, you don't want her to move excessively.
So whatever chi, now I'm like chiing everything because we're talking chi. So whatever she chooses, wow,
Mm-hmm.
that's even better. The chi she chooses,
Mm-hmm.
that would be the right thing to do, right?
Right. Mm-hmm.
Girlfriend, you're hurting.
Yes, she is. Good girl.
Cutter is hogging the camera from the back. Nobody can see that, but Cutter is just like back and get serious with her. Just move them off. Let's go. There you go.
The other thing you'll see when you acupuncture an animal is there's different, what the Chinese call constitutions. There's five major constitutions. There's wood, there's fire, there's earth, there's water, and there's metal. And each of those constitutions that every animal and every person displays predisposes you to different diseases. It also creates your personality type. And when you acupuncture a horse that's an earth horse, for example, an earth horse loves touch, loves to be palpated, and loves needles. You can put 20 needles in an earth horse and they'll ask for more. Fire horse
With Shana.
depends on the day. Some days they're going to like needles, other days they don't want you to go near them, and they're more like a wood horse. And a wood horse is the type of horse that when you walk in the barn and it lays its ears back at you and shows you its teeth and turns around to fire a couple of shots at you, that's what a wood horse is like. Most wood horses, if you try to acupuncture them, you might get 1 to 5 needles in if you're lucky.
Wow.
This is why herbology and Chinese herbal medicine has come into play a lot in veterinary medicine. Is there's a lot of horses and cats and some dogs that don't accept needles very well. And if they won't accept needles, you need to still get the qi flowing, and the herbs are meant to accentuate or to prolong the effects of the needles. And so we can always add herbs to an animal that won't allow acupuncture, or that it's dangerous or difficult to do acupuncture on. But the horse like Shana, today she's very sensitive to these needles, but 2 days from now she may be a whole different horse because she's a fire horse, and some of them accept needles and some of them don't.
Is it maybe based on the level of pain? Because
Yes.
there's only so, I mean, and it's sometimes hard to tell with her. I can never say if she has a high threshold or a low threshold of pain, because she's so sensitive that sometimes I feel, well, keep on moving it. That I sometimes feel she doesn't have a high threshold, but then sometimes she's so stoic that I feel, oh my God, she might be in more pain than she lets on. It's very hard to gauge with her.
Yeah, and that's the way it is with a lot of fire personalities. It's hard to determine, what kind of pain they're going through, because they can hide it well if they need to.
Yeah.
And they also will express it very well too, if they have the right person that they're with and they're open to it. She's more likely not to want to show pain with all of us standing around here.
Because she's like, nothing is wrong with me, right? Oh, okay.
Okay, I'm going to try and put an acupuncture point right on the ventral midline. The ventral midline is considered the yin aspect of your body, and the dorsal midline is considered yang, and yin and yang feed into each other. Yin will increase moisture and hopefully decrease inflammation in a case like this, whereas if we were to stimulate her dorsal midline, that stimulates yang, and we don't want yang. It's strong, it's powerful, and we've got too much strength and power in these legs right now. So I've just acupunctured right between her legs, right on the midline. She thinks I'm going to do it again, which I'm not. It's already in there. And that point is her association point for her heart. And because we've got an issue with blood vessels and an increased heart rate, this will help try to bring her heart rate down and decrease the blood pressure in those feet. It would be ideal at this point to try to put some needles in her feet, but I don't know if we're going to get away with it. Want to try? Want to try?
I want to come onto your side.
Okay. So,
you can probably lift them up to pick up the foot and do it, maybe.
what I'm going to try is something called Hemoacupuncture, where we're going to put a regular hypodermic needle instead of an acupuncture needle into the foot, and what it will do is try to release some of the blood that's stagnated there. It's just about the same. It's the same technique, but it will allow blood to flow out of the needle because it's a hypodermic needle, if she'll allow us. Okay, so you want to come over here on my side?
Yeah, just so. I should be, as the handler, be on your side, but I guess.
For this, it's probably better if you're on the other side,
Okay.
because I need to be right where you need to be too. You need to be near that shoulder, and I need to be near this shoulder.
Okay.
And other things that will help in a situation like this is either to be scratching her, or playing with her nose a little bit, or giving her a treat. Any of those things can help. She knows what I'm doing. She's a very smart horse. She's already knows that I'm going to go near.
I mean, you might be able to do it, pick her foot up.
That's the other way to do it, is you can do it while their limb is standing, but you can also pick the limb up and put the needle in. And I was planning on doing it with her standing, but I can certainly pick her limb up too, depending on what she's like. Come on, honey. Okay, we'll try picking it up and doing it that way. Easy, honey. Easy. Ready? 1, 2, 3. Oh, bounced right off. We'll need another needle. Yep. It's okay, sweetheart.
I can hear she's like, stop! What are you doing?
Come here. Just one. Just one. Okay. You playing with her nose or petting her?
Yep.
Ready? 1, 2, 3. Good. Okay.
Nice job, baby.
I'll switch sides and I'll try this one.
Don't worry.
I'm sorry. I'm sorry. This will make you feel better, huh? Good girl.
You're not tricking me.
Ready?
Yep.
1, 2, 3.
Funny though, this one is not as bad. Seems. Oh. She's like
Stepping on her own feet. Yep, one more after this. Okay. Good girl. Good girl. Ready?
Yep.
Easy, sweetheart. She's learning how to count, I think. 1, 2, 3.
She's not going to like us for a couple of days after this.
No.
We know that already.
Although you never know. Sometimes after you pull those needles out and she's feeling better tonight, she'll rethink this.
Yeah, she's smart enough that she possibly would. How about that hose in the middle of everything?
Want to remove that or no?
Nah, well, I didn't want to put her feet up.
Okay. Okay. Ready? 1, 2, 3. Okay. Okay, we'll just leave those for. Oh. You know, there's different amounts of time. Here, we'll move that hose first. I can get it if you just walk her that way.
We'll just put it this way. There you go. Look chew. So.
So I could put more acupuncture needles all around her hoof wall, but again, I don't want to overstay our welcome on her feet, so we're just going to put those in for now. There's about 3 more spots per foot that would be good.
Those are the ting points?
Ting points, very good, yes. Ting points. They're the starting or ending points of the major channels in her feet. And they're an excellent spot to put needles in to try to get release or flow of the qi.
So those would be the points also I should probably maybe put my finger on, massage.
Yeah, you can do acupressure on spots like that, and all along the hoof wall is a great place to do that. You don't actually have to hit the exact location.
Actually, that's what Mr. Zander, the talking horse, told us, to just put our hand like this on
the hoof wall?
And that should do it. And
Sure,
and
yeah.
do that,
Mm-hmm.
yeah.
Mm-hmm. So there's different thoughts on how long to leave needles in or how long to do acupressure. The majority of the case in humans, when they put acupuncture needles in you, I assume they usually leave them in a half an hour. It's a nice convenient time for you to rest and relax and deal with it. And in animals, we take each patient differently. Ideally, we're looking for 20 to 30 minutes. If an animal is really antsy and not enjoying it and having a hard time, I'll take the needles out after 10 to 15 minutes. If they are enjoying it and you can see them relaxing, I'll leave them sometimes up to 45 to 50 minutes.
She seems to be chilling with
yes.
licking, chewing, yawning, releasing, so this is a good sign
Right, right.
for her right now. So
Yeah, it'll be interesting when I'm done to take her pulse and see if that's gone down and see if we have any change.
we'll be hanging here for a while and we'll be back.
Mhm.
The
Yeah, that's important. You're right. That's a good point.
So there's lots of releasing. So this is good stuff. My baby.
What do you think, Shana? Huh?
Not too bad after all. And I also always look for, for her personality change. I mean, she's usually the kind of horse that wants to be with me a lot. And funny enough, now she's more and more reaching out. When before she was almost like, I don't even want to deal with anybody because she's uncomfortable. I think she's just not in a good place health-wise. I always look at it as like, it's almost like we have to, because she has so much joint ache, she keeps picking up her feet and stretching her hind legs, and it's almost like, the flu symptoms are someone who wants to be with someone
Yeah,
close
sure.
by, but something right
Yeah,
now.
this is pretty amazing, actually.
Yeah, she is like really releasing a lot. And she has been occasionally picking up her hind legs and stretching them out too. So you only put that one top one, the one in the midline, the one by the shoulder?
Yes, those are on the pericardial, along the pericardial axis. Mm-hmm.
So now something just shifted because now her eyes are kind of closing and she's more zen.
Yeah, here it comes now.
No distraction.
Here comes the blood.
Now it's bleeding.
Mm-hmm.
Now, would that be normal either way, that there's blood now coming?
You can sometimes in a normal hoof with no laminitis, yes, you'll get some blood flow, but it's pretty consistent at all spot. Every one of her feet is releasing blood, so that's more than you'd see in your average horse that you would stick a needle into their hoof
And
wall.
you did not necessarily hit a vein.
No, no.
This is in the tissue, so to speak.
Mm-hmm. I'm just taking him out now, sweetheart.
Well. Oh, stop it. Oh, good.
You don't want me anywhere near you now. Okay.
There you go. Forehead, right? This one here.
Yeah, there's one on forehead, and then the last one I take out is this one.
First one you put in.
Mm-hmm.
Good.
Good.
Job.
Okay.
Now we're going to just take some blood
Yep.
for the...
Yep. Before I do
what
that,
are we going to test for?
we'll be testing her ACTH level and her insulin level again, both, to make sure there's not a primary metabolic or endocrinologic reason for her laminitis.
Yeah. Now, and if you take her pulse now, does the aggravation of you taking the needles out, would that...
That's a good point. I'm not sure. But there's no question that the overriding effect is if we've had a positive effect on feet and taken away some of that pain, that's going to override the short-term effect of just this short perturbation of bothering her from taking the needles out. So, you
Let's
ready?
check. can breathe. She's not even breathing. It's just
Well, it's interesting because when I first started taking her pulse, it was pretty fast. And the longer I hold it, the slower it gets because she thinks I'm going to do something. She thinks I'm going to put a needle in. So as I stand here and she realizes nothing's happening, she's starting to relax a little.
She's always trying to think ahead of whatever someone is doing. So it's always like trying to be prepared.
So if I'd taken the pulse when I first put my finger on, it was up the same, at 48 to 50 in fact. Right now it's dropped back down and it's about 38 to 40. So when we first started, it was 45. It's not dramatic. There's a little bit of improvement. But it just also goes to show that it also depends. There's a lot depending on her feeling right at that moment when you're taking her pulse. You got to make sure that it's consistent. You give her time to
adjust. Realize what you're doing. Yeah. So there could be a lot of false reading.
Yes.
So also, I usually don't release the horse right away after the treatment, especially if it was a treatment that wasn't all that comfortable, because I don't want to take the halter off and she just shoots off and goes like, oh, finally I can get away. I want her to have a good experience, and so I'm doing something that I know she likes because she has tick bites in her tail and it's always itchy, and it's usually something that she would ask me to take care of anyway. To scratch her a little bit, so I'm doing that and see how she's pretty tuned in and sees is aware of what I'm doing, and so I kind of just always want to connect. Now it turns out actually Dr. Perdrizet wants to take her temperature just to see where we're at, so why don't we do that, and then after that I'll do a little check-in again and then let her go. So the temperature is normal. 100 even. All right. So I like that. If she does that before I release her, even better. So then I feel like she kind of chilled a little bit and doesn't hold the tension. I mean, this is the kind of horse I would not release. If she's like this, I would not let her go. I want her head to be down. I want her to be relaxed. I want her to be okay again and connected and in her body, rather than having left her body and be like, you know, I can't stay in this presence of people and this work anymore. So I feel pretty good of letting her go. So big thank you to Dr. Perdrizet, who's taking his notes over there. Let's do a scan. Do a scan over. There he is with his team. Yay, thank you. And I will see you next time in the field. Bye-bye.